Hi, I'm Michelle Bullock, and this is Menopause Facts, Menopause and Bioidentical Hormone Replacement Therapy. Thanks for joining me. Menopause is the cessation of menses 12 months after the last period. Average age, 51 years old. Symptoms can start as early as 45 and last for up to 10 years. Menopause is the result of ovarian failure, causing a cascade of events of hormone imbalance throughout the body. The hormonal imbalance that menopause creates has a variety of symptoms. Most common include vasomotor, such as hot flashes, urogenital atrophy, cognitive dysfunction and depression, and sexual dysfunction. Treatment for menopause symptoms includes replacing lost hormones, such as estrogen and progesterone. These two are the most common. Recent studies have shown that it might be important to look at all hormone panels, including testosterone, DHEA, LH, FSH, and TSH. Replacing these lost hormones can result in an improvement of symptoms, including better sleep, relief of hot flashes, improved mental clarity, vaginal lubrication, improved sex drive. Again, looking at all hormones for a multifactorial approach might create a better symptom control. Over the last 20 years, there's been many shifts in the way that we view hormone replacement therapy. In 1993, the Women's Health Initiative conducted clinical trials studying the effects of hormone replacement therapy on chronic disease prevention. This developed new guidelines as well as identified those at risk for adverse events. Prior to the Women's Health Initiative, hormone replacement therapy was thought to produce a cardioprotective effect. This led many providers to prescribing hormone replacement therapy for their menopausal patients. Prior to the WHI, 40% of menopausal women received hormone replacement therapy for control of menopausal symptoms and chronic disease prevention. What we learned from the WHI is long-term use of hormone replacement therapy is related to an increased risk of cancer and thromboembolic events, including stroke, cardiovascular events, breast and ovarian cancer. After the WHI was published, there was a 50% decline in the use of HRT by menopausal women. After the WHI, provider guidelines changed. Hormone replacement therapy was no longer recommended for chronic disease prevention. However, HRT can be used to control menopause symptoms. Evaluation should be done on an individual basis, and treatment should be guided by symptom severity. As the guidelines changed, bioidentical hormone replacement therapy gained popularity for those suffering from menopause symptoms. These are hormones that are identical to those circulating in the human body, can be compounded or manufactured. Some manufactured applications are FDA approved. What we know about compounded HRT is there's limited data on the safety and efficacy. Compounding applications can result in an over or under exposure of hormones, and overexposure can increase risk of cancer and cardiovascular events. However, there is anecdotal evidence to support the use of compounded bioidentical hormone replacement therapy. This might be a woman's preference. Some women believe they achieve a more individualized care plan for their symptom management, and this often is more effective at controlling symptoms. In order to find out the hormone levels for women and whether they're suffering from symptoms of menopause, serum or salivary testing might be recommended by your provider. Hormones should only be adjusted to the therapeutic level for symptom management and not targeted to the hormone level itself. Recommendations for treatment are as follows. Always use the lowest therapeutic dose, targeted towards symptom management, the shortest duration possible, and use only in safe populations, younger women, ages 45 to 55. Discontinue hormone replacement therapy as soon as possible. Taper is not indicated. Patient education should be covered in detail for each individual. Risks and benefits assessed. Side effects of treatment reviewed. And routine screenings necessary at preventing chronic diseases. Thank you for joining me today as we reviewed Menopause Facts,